Sepsis can lead to multi-organ failure and death. The endotoxin is a fundamental component of gram-negative bacteria. Elevated circulating levels of endotoxin might identify patients at higher risk to develop a more severe disease.
The Endotoxin Activity Assay can be used as a simple, quick, and reliable biomarker of systemic endotoxemia. The early detection of this toxin might help clinicians treating patients with septic shock.
In patients with septic shock, the early identification of a rapidly evolving condition might prompt a quicker and more intensive life support therapy, potentially leading to better outcomes.
Demonstrating this procedure will be Lisa Mathiasen, a molecular biologist who collaborates with our research group.
To begin this procedure, set out an EA test kit and unpack the 5 different kinds of tubes. Use tube number 1, the control tube, to measure the basal activity of the nonspecific oxidative burst of patients' neutrophils in the absence of a specific antibody. Use tube number 2, the sample tube, to measure the oxidative burst in response to the LPS antibody complex. Use tube number 3, the max tube, to measure the maximal oxidative burst of patients' neutrophils in response to an excess of endotoxin. Use tube number 4, the LPS tube, as a source of exogenous endotoxin, and use tube number 5, the aliquot tube, for blood storage. Collect patient blood samples in sterile tubes containing each